This meeting is being recorded.
Morning, Joe.
Yeah, morning, Eduardo. Good morning, everyone.
Good morning. All right, so I will get started. Welcome to the Southern Vermont New Vermonter provider.
Wherever, and she finally found it under your dad's role.
One second. And this meeting is really a monthly opportunity for anyone who regularly engages with or supports our New Vermonter community to provide updates, share topics that are top of mind, whether from their agency perspective or from the New Vermonter community perspective. We focus on things like maternal health, housing, and among others. Today's meeting is really focused on our Agency of Human Services and the support and resources provided through that agency for New Vermonters and Vermonters generally. I will first provide an opportunity for our resettlement organization to provide a quick short update if there is one. And I'll have Joe, you can say a few words in just a sec, but really I hope those who do work for ECDC and CASP and any other organization, you have questions and start thinking about questions for the folks who will be presenting to us today. So Joe, any short updates on what's top of mind or things that service providers should be made aware of?
Good morning. Yeah, let me just give very short update. So our FY23 for Bennington was approved, so which means that Bennington now is officially one of the resettlement sites. To Brattleboro and Bennington in the south are now considered resettlement sites by PRM. And for Brattleboro, we still expecting 100 refugees to arrive for FY23 and 50 refugees for Bennington. We are opening a smaller office in Bennington, and we are in search of an office space. In addition to the staff we have there in Bennington, we are also looking to hire 2 case managers in the area. For everyone to know that lessons we learned from the APA program, we will not start receiving refugees in the Bennington area for FY23 until we set up the office there. On Ukrainian program, we are not directly providing services, but rather if we are required to do so, it means that if there's a breakdown relationship between the sponsor and the Ukrainian family, then we can step in. Our catchment area is Bennington, Windham, Windsor, and Orange counties. And through that program, we expect at least 25 individuals who have applied to come to the area. So in anticipation of all of that, the 150 plus 25 might give us maybe 175 individuals for FY23. That's so far the update from our end right now. Thank you.
Great, thanks so much. And I do see a ton of folks from Bennington County here. It's great to see you all. And I'll take this as another opportunity to just reemphasize that this is a bi-county, collaboration. This group is welcome and open to all. So if there are folks from your community who you think should be on these calls, absolutely invite them. All are welcome. This really is all about Southern Vermont. Without further ado, I would like to introduce Sue Graff, the Windham and Windsor side of Regional Head of Human Services. Sue. Welcome.
Thanks, Alex,
Thank
and
you.
thanks everybody. It's when you have two screens of people, it's great, but you can't tell who's on this call. So I'm trying to sort of toggle through and see everybody. So great to see everybody here. Thanks so much for your attention today. We wanted to provide an opportunity, and I have a lot of my colleagues on the line, so I'm not going to say too much other than give you just a quick kind of overview of the Agency of Human Services, with the expectation that this hour really is about building relationships and you getting to know, everyone getting to know each other and who does what. And so I'm going to lean on my colleagues to sort of tell you a little bit more about what they do within the agency, within our districts. My colleague Adam Sansick and I are what's called field service directors. So we are your conduit if you need us to the agency. We work in the districts. My colleague Adam covers the Bennington district and Rutland, and I cover Brattleboro and Springfield. So primarily for refugee resettlement work and ECDC's relationship across Southern Vermont, we're your agency kind of point of contacts if you need us again. But our goal is for you to develop relationships with the staff within the departments of the agency and in the district offices. We do have state offices in Brattleboro. We have state offices in Bennington, Rutland, Springfield, and the 12 AHS districts across the state. So what our field services directors, what part of our job is to help you navigate through the agency if needed, find out who does what, help you connect to the people who can help in situations. But as you're very well aware, immigrants to the United States and to Vermont have particular benefits and services that they're entitled to. And so we want to make sure that you're able to access those services and benefits on behalf of your clients, that we can provide culturally appropriate services, translation, whatever is needed. And so part of this, the reason for today was really also understanding that we're a year into this work almost. And we certainly had our ups and downs. This is new work for ECDC. This is new work in a lot of ways for many of my state colleagues, because most of the refugee resettlement has happened to the north of the state. USCRI is the refugee resettlement agency in the northern part of the state and has been in the state, I think I heard the other day, for 20 plus years. So they've been doing this work a long time. They well understand the system, and we're all learning here in the South. So just wanted to provide an opportunity for you all to ask questions, provide scenarios if there are particular things that have happened in the resettlement process or beyond that as people continue to live in Vermont as new Vermonters. If our agency can be helpful, or if you're not sure if we can be helpful, this is a time to kind of do that Q&A and provide a scenario. I would ask obviously not to provide any detailed information. We don't want names, we don't want dates of birth, we don't want health information. But if you have a scenario or you have a situation that you've been challenged by, or you have a general question about, by all means, today is the day. So as an overview, I said I wouldn't talk much and then I just kept talking, which is what I tend to do. But just as a general overview, and I did send to Alex kind of a real brief overview that he'll send out after today's meeting, information that I did provide a couple months ago to ECDC staff, but I know there's been lots of additional staff and we have other people beyond the Refugee Resettlement Organization staff on the line today. So hopefully that'll help just kind of center and make a little more concrete what I'm about to say. But the Agency of Human Services is big. I think it might be the biggest agency in state government, but don't quote me. We have 6 departments, and within those departments, there are lots of divisions, and my colleagues will speak about some of that. And in your work, you will interface with some of these more than others, but let me just give you the overview. So we have the Department of Corrections, which includes probation and parole. That's pretty unusual for an Agency of Human Services to include corrections, but here in Vermont, we do that. The Department for Children and Families, which is probably the largest department. I would say it is the largest department of the agency. Many, many divisions within the Department for Children and Families: Economic Services, Family Services, the Office of Child Support, the Child Development Division. It's a ton of work. The Office of Economic Opportunity, tons of work happens within the Department for Children and Families. It's pretty broad. The Department of Health, pretty self-explanatory, and I know a lot of interaction within this work with the Department of Health. The Department of Vermont Health Access, or DEVA, which is a fun acronym. That's really about medical insurance. So again, in this work, DEVA plays a pretty significant role in terms of access to Medicaid, perhaps challenges if you're having folks try to engage with the with Vermont Health Insurance, DEVA, the Department of Vermont Health Access, is a way into that. The Department of Mental Health and the Department for Disabilities, Aging and Independent Living, or DALE. So, and within DALE, there is a division, Hireability, formerly Voc Rehab, which some of my colleagues will speak about. That's also around employment. And so that's a big piece of what you might have already interacted with. Some of these 6 departments don't have district staff. So you don't have to really know that, but just know that the state does its work with state employees in our districts and community partners. And so the biggest example of that is the Department of Mental Health. So we have designated agencies, so organizations within the state that are independent nonprofits who work on behalf of the state to provide community mental health. And so I know I saw Steve Jurenkoff from HCRS is here today. There may be colleagues from UCS. Pardon me if I don't recognize my Bennington cohort. Adam's not here to point you out, but you'll have an opportunity to speak. And I know we have some Bennington folks as well. United Counseling Services on the Bennington side is the designated agency. And so just know that the community mental health model, and Steve and UCS colleagues can speak more to this, but that is designed to provide access to mental health services for people in Vermont, with or without the ability to pay for that, insurance, all that. And so there's a way into mental health services. And I know HCRS is going to play a bigger role in terms of refugee mental health, and I'm sure Steve will talk about that. But know that DMH does not have, the Department of Mental Health does not have district staff. We do our work in collaboration with the designated agencies. And so there's some other examples of that, DEVA being probably the most, the other example where we don't have necessarily Medicaid specialists or insurance specialists in our district offices, but some of our other departments, like the Department for Children and Families, do, and DALE do provide some amount of support to their clients around accessing Medicaid and other insurances. So, and the health department, things like that. So Department of Health is public health, works very closely, and I see a colleague from the Brattleboro Memorial Hospital on the line today. We work very closely with health providers in the districts. And as I think you're all aware, we have a refugee health officer in the state, Allie Perline. I don't think she's on the line, but I know, in your work, you're connecting both to the statewide resources and to the local district providers and partners. And so again, if any of those connections become confused, or you're wondering how we can support or what some of the resources are in the districts, myself and Adam are good point people, as well as the folks you're going to meet today, if you don't already know them. So I noticed when I looked around, I've got colleagues here from Family Services Division in Brattleboro. Lisa Bruce is here. Chloe Updegraff, who's the district director for the Vermont Department of Health in the Brattleboro office. Amy Goldberg and Sadie Fischesser, who are with Economic Services, again, out of the Brattleboro district office. As I mentioned, Steve from HCRS. And then I saw Diane Torres from Hireability and Nancy Dwyer from Hireability. So again, those are divisions within DALE. If there are other AHS folks that I missed, please introduce yourselves and speak up. As I said, and I see Allie is here as well. I want to give them an opportunity to sort of talk a little bit about their specific work within the agency and how they can support your work and how we can work together. And then again, have an opportunity for us to kind of answer your questions. This is really meant for you to, understand what we do and how we can support your work. So, and partner with you. Is that, Alex, am I on track there?
Yeah, absolutely.
Okay, great. So of the folks I just mentioned, it'd be great if folks just want to unmute and introduce yourselves. I don't know if you want me to, maybe I should call on you if that makes more sense. And then we'll provide some time if I've missed anybody, especially on the Bennington side that I didn't recognize, so apologies. So Lisa Bruce, you want to introduce yourself and say a little something about Family Services?
Hi, I'm Lisa Bruce. I'm the district director here at Family Services. I've been here about 20 years. This is the Child Protection Agency. So when we get reports of abuse or neglect, we go out and do assessments or investigations to determine if the kids have been abused or neglected. And then We sometimes have to write affidavits if there has been egregious abuse and bring kids into custody, but that doesn't happen very often, actually. For the majority of the cases, we do referrals, put supports in place for families. We also handle the juvenile delinquents, kids that commit delinquent acts and have, been charged. So we hold the probation cases for those kids. And we actually do a lot more work than what people think about, like they think custody. And that's not the case. That's a very small percentage of the families that we work with. For the most part, we support them and get them the services that they need. And even if kids do come into custody in the smaller percentage of cases, the goal is always reunification. So the workers spend a lot of time with families over the course of 6 months, 8 months, maybe a year or more, working with the family to get them stable so that the kids can go back home. We have had a high custody number in the past, and right now we have 116 children in custody, which is not overly high. For all of Windham County. And we also deal with the youthful offenders, kids that commit acts that are they could be charged, or kids that are 18 that are charged, but it's not one of the big crimes. Then we deal with them. They don't have to go through DOC. They come here through family services and have their probation officer here. I'm not sure what else you'd like me to talk about, but I'm open for any questions you might have.
Yeah, thanks, Lisa. That makes sense for people to ask questions maybe after each of you say a little something, if you have them, and then we can circle back as well. Any questions for Lisa for Family Services?
Yeah, I just wanted to ask, which office is Lisa based, Brattleboro or Bennington?
Brattleboro.
Wow.
Yeah, and I did see the question in the chat, Joe, with the regional contacts. So I'll provide a list. I have them for my districts, and I'll connect with Adam and provide you all with contacts for each of the departments and contact information as well. So
Great.
I'll get that to Alex before too long. Thank you. Great. Chloe Updegraff, Vermont Department of Health in the Brattleboro office.
Good morning, everyone. My name is Chloe. As Sue said, I'm the district director for the Vermont Department of Health in Brattleboro. Our office covers a variety of public health needs from the WIC program, which any new Vermonters would qualify for. So that's nutrition education and food assistance for parents and kids and families. So our office has nutritionists that work within the WIC program. We do vaccinations. We've already had a really great partnership with ECDC and some other local organizations to make sure that new Vermonters have access to vaccines, and that's COVID, flu, but that means everything else. We vaccinate for a variety of things for both kids and adults. We also work on healthy communities, making healthy foods, making access to exercise and outdoors more accessible for folks, and have a variety of projects going on with that. We also do work with health equity, and that's an ongoing grant that we're part of. And then everything, public health related outside of that. So working with our schools, working with community members on disease monitoring, tuberculosis, staph infections, anything else. So we kind of have a wide range of work being done within public health. But for me, my goal for our office is that we are a resource and a place of comfort, especially for our new Vermonters. So we're making sure that everyone that's new in this community has access to WIC, access to materials translated in their own language, access to vaccinations, and that we can also gap fill for when folks aren't able to get into providers, that we can kind of fill some of those gaps as well. So my main goal is that we're really meeting the needs of the new Vermonter community, and not just meeting their needs, but really making sure that they feel like they're a welcome and important part of this community.
Thanks, Chloe.
Thanks.
And Chloe's being very modest about also the role that the health department played, obviously, in the COVID pandemic, and worked with many of you around, health equity and outreach to new Vermonters throughout the pandemic. And I know I see United Way on the line, and other folks worked really closely with the health department. There's also a division of the health department, maternal child health. Deb Kitzmiller is the person on the Brattleboro side, again, working really closely with health providers and with a particular focus and connection to our new Vermont families who are pregnant, parenting, have young children. So those are particular parts of the health department that may, and WIC certainly being a piece of that as well, Women, Infant, Children program. So any questions for Chloe at this point? And if there is somebody from the Bennington side from the health department, please feel free to unmute and introduce yourself as well.
Sue, this is Grace from Head Start in Bennington. Because I don't see anybody from the Department of Health here from WIC. I just have so I'm asking Chloe a question that may only apply to Bennington. Is there a way to make the educational requirements of WIC more user-friendly for our new arrivals, not necessarily Afghans, but any arrivals? Because if you don't have English as a first language, it makes it a little bit tricky.
Thanks, Grace. That's a really great question. This has been a personal, I don't even know what you would call it, mission, I guess, or vendetta for me. The WIC program is really great, but it's a federal program. So there's some bureaucracy and some difficulty, especially for folks that don't speak English as their first language. So we are working on that. If it's not something that can happen at the federal level, we're really trying to make the access better at the local level. So that is in the works. It is taking longer than what I would like, but our work is to get some of the WIC, all of the WIC materials translated to meet the needs of our local communities. The problem is federally, WIC won't translate unless it's a top 5 language spoken in the state. And so with some of our newer arrivals, some of those languages aren't in the top 5, and there's some bureaucracy there that's just really tough to work against. So we are working on this locally, working to translate materials, and then also a couple of folks at ECDC, Camilla, Jill, had some suggestions that we create materials that are more user-friendly for folks at a lower reading level as well. So I thought that was a brilliant idea. I'm pursuing that as well. So it's in the works. It just is taking a frustratingly longer time than what I'd like, but yes, it's in the works.
Just a comment. All of the women who are on WIC in Bennington County are illiterate in Dari. All of them.
Yeah, I know we have some similar in Brattleboro as well. And so, yeah, the idea that Camilla and Jill had at ECDC was to, take the materials and make them more visual, get rid of some of the wording on there and just make them, again, meeting folks where they are. And so the literacy is definitely something that we're trying to take into account, along with just making sure we have the materials translated, but then from there, working to see how we can meet folks a little bit better. So yeah, it's a good point. It is a definite personal mission for me to get this figured out and try to work through our system here in the state and then the federal program that is WIC. But yes, point well taken. We're working on it as best we can.
Thanks, Chloe. It looks like Megan Winslow has a question. Yeah, Megan.
Just a quick update on the Bennington side. I just got off the phone with Stephanie from WIC at the Bennington office, and I'm working with her on some more sort of individual in-person outreach to families to help understand their benefits. And the idea is that in person as opposed to over the phone, which I think they've been doing for some time since the pandemic, will help as long as interpretation is provided.
Great, that's a great update. And yes, I know I think previous to the pandemic, it was required that WIC participants come to the office at least twice a year for in-person, updates and sort of updated information. During the pandemic, that transferred to phone services being allowed, and that was obviously super helpful on one level, and maybe less helpful. And so Chloe can speak to maybe my understanding is that people who want to come in person can at this point, and are welcome to. And then, of course, if it's an immigrant family, we would provide translation during that consultation. So in all the state office buildings, when you have WIC participants for whom English is not their first language, that's an in-person appointment with translation is always an option. So, and Chloe, correct me if I'm wrong on that. And it looks like Camilla, you have a question or a comment? Oh, I think you're
Sorry. Yes, just wanted to clarify that as much as I'd like to, I can't take credit for the ideas about providing visual explanations that the illiterate clients can access better in order to understand their WIC benefits. Erica at WIC here in Brattleboro, together with Autumn, who works with Winston Prouty, are working on this with our clients or for our clients to give actual visual with pictures support to understanding how to best use their WIC benefits. Thanks.
Thanks, Camilla. And I know we have Allison Wheeler is here from Winston Prouty, who's the Children's Integrated Services organization. And so I will circle around to them as well, because that's a piece of the work that we do, again, in partnership with community partners. And that I think that, you're already interacting with some of those with the Children's Integrated Services. So I want to make sure you understand that system as well. So we'll circle around to that after this. Melissa, go ahead.
So I'm Melissa Senegal. I'm the curriculum director in Southwest Vermont Supervisory Union, which is Bennington. So I am also the EL point person for the district. So anything pre-K through 12 for our public schools here in Bennington, I would be the person that you would go to. In a moment of gratitude in this week, I look around the room and I see all of the community partners that for all of the rest of my job would not be possible without all of you. So thanks for giving me the moment to just say thank you. I see you all out there. I feel bad about shouting just some of you out and then leaving anybody out, but I'm thinking of UCS and Tutorial Center, and the list goes on for the people in the room that provide all of those. We would not be able to do this without all of you, so thank you. My point is to make sure everybody knows about the following. The state AOE gave us the recommendation for some of our newcomers that because of cultural differences, that we would make some understanding to enrollment, that we look at the year, but we understand because of, again, cultural differences, that the dates and the months don't align with, let's pretend, a kid from Colorado who's moving here. And that's okay, because those are different and we can make those allowances. What we're running into is an interesting case of, because coming over birth dates, days, and months are not something that is always happening in some of these places that our kiddos are coming from, that the birth date or month, not year, is different on some of the forms. And so we're being told to be receptive to the families to adjust when needed. And yet we're finding that some of the older paperwork that aligns with what would be their Medicaid or any of that is going back to what was an incorrect date. And so it doesn't necessarily affect us, but having us all be on the same page so that what we've been told is be responsive to the families and what they need, and that this might be different. So I'm just kind of bringing up a potential hiccup that could come up with a new Vermonter who is coming in. We're being told to be receptive to the families and adjusting those dates of birth, as I believe that we should. And Medicaid, potentially, let's say a student has the need for some special education services, are going to be billed, and what they're going to be billed at is a date that was filled at when they first arrived and is incorrect. So I just kind of want to bring that up as an interesting thing that we'll solve for these families, and how we do that all together. And then my other request from the group, and I'll stop, is those 50 families that you brought up that would be coming to the Bennington area, I'm really excited for. I'm also loving the fact that there's a plan for having an office here first set up so that we can make sure that those are another layer of support. And I would advocate that as soon as we have things in place to learn more about those profiles of those families that have school-age children, so that we can do specifically hiring supports is what I'm always trying to get ahead of. And so I just putting that out there. I know it's hard to plan for things that we're not quite sure of, but if people could contact me that would be great. Thank you very much, everybody.
Thanks, Melissa. And you point out the really close intersection with all of our service systems and all of our bureaucracies, if you will. So certainly education and school systems and our Agency of Human Services and Medicaid, and the only thing that we can point to when people complain about the state is that the federal government can be more bureaucratic than the state government. And so those dates and that documentation are really, obviously can be a sticking point. And so that's a great point in terms of use us and work with us. And if certainly if those birth dates or that documentation becomes an issue, if we can help, help you access folks at DIVA, for instance, around Medicaid and things like that to really understand the issue. That's a point of, of a partnership that we can provide. So thanks for bringing that up. And, really great. Obviously, there are partners beyond our agency departments that we're leaning on and we're working with. And you point up a great intersection of those systems. So thank you. I want to introduce Economic Services, again, one division of the Department for Children and Families. So we have Amy Goldberg, who's the Reach Up supervisor in the Brattleboro office, and Sadie Fischesser, who's the operations director for both the Brattleboro district and the Hartford district. So Amy and Sadie, if you want to say a little something about, or a lot of somethings about Economic Services. I know you're heavily involved in and kind of the bread and butter of a lot of this work in terms of these new families. So take it away.
I'll start. I'm Amy Goldberg. I'm the Reach Up Supervisor for Economic Services Division here in Brattleboro. We have also been learning a lot as this first year of having new Vermonters come through and use our services, which is great. We provide, as a Economic Services Division, we provide access to different programs. Reach Up is the TANF program, that is cash assistance for families with children who meet income guidelines. Then, of course, we have three squares or food stamps, which that provides food for individuals and families, again, based on income. We also carry the seasonal fuel program for people who need help with heating. We carry the essential person program for someone who needs someone to live with them to care for their needs if they qualify. All of this is income eligibility based. And then we do have the general assistance program, which includes emergency housing, personal needs, dental vouchers, and the like. So people come through by phone, in person, to try to access services. And we've worked pretty closely, UCDC and us, as far as New Americans go, with trying to get people through the process to get on our programs. I think that's gotten a lot better over time, people getting on, knowing how to apply, knowing what paperwork has to happen, knowing, remembering that there's a phone interview that has to happen for some of our programs too. That's a necessary component. So I think that is going fairly well at this point. I think people are pretty well versed in getting people onto those things. If anyone has questions about what we provide or, want other feedback, please weigh in.
Sadie, do you want to say anything or introduce yourself?
Sure, I can introduce myself. My name is Sadie, and I am the operations director. As Sue said, I cover multiple areas as well as the remote unit, and we will have our colleagues from Bennington join some future meetings. But since a lot of our work is statewide, the 1-800 number, which is toll free, is, people can always call there from anywhere in the state. and get services that they need. Almost none of our services actually require in-person contact at this point if people are concerned about transportation. So that's been something that's changed since COVID, which has, I think, been a huge benefit. But as Amy said, our team in Brattleboro and our team in Bennington have been working really closely with ECDC, and I think have worked out a lot of sticking points and just given a lot of information about each other's work so that we can try to streamline the services, not duplicate, but also make sure, there's a lot of paperwork that it doesn't fall through the cracks. So, yeah. Oh, thanks. I was going to put that in there to put the 1-800 number in the chat for everybody. So thank you.
And there are, was looking for the link, and maybe Sadie or Amy could do that. There's a great, I think the state website in terms of the benefits and all the different categories of benefits and the applications and the forms and the information has been reconfigured and is very straightforward and sort of easier to use and access. And again, as with all of our services, folks can do, and we certainly want to, when it's beneficial, do things on the phone or use, document uploader and, use the tools that we can, but our state office buildings are open and available from 7:45 a.m. until 4:30 p.m. Monday through Friday. And so those are also ways for you to, if you want to come with your clients, talk to our staff about, making sure translation is available. We have on-demand translation in our state office buildings, telephonic translation. So, we're going to accommodate needs that are presented. But certainly part of today is to also get to know kind of who's in the office and who you can contact to make sure that your families or individuals' needs are going to be met when we meet. So the in-person work can happen at the district office buildings every weekday. So questions about economic services? I know it's a huge division, but anything people want to ask or clarify while we've got folks on the line? All right, I'm not hearing or seeing anything. And I think we're just meeting till 11, so I'm going to move to hireability. And then I know we have somebody from UCS here as well, Lori Vatican. So I think we'll move to mental health. And I know we have an update from United Way about their refugee services, dental services through the Windham County Dental Center. And so those are the things we're going to try to highlight and at least talk through and also have some time for questions. So hopefully we can move through that. So hireability folks, we have Diane Torres and Nancy Dwyer. I'll let you decide who wants to go first and say something about your work.
So hi, everybody. I think my colleague Leo Schiff from the Brattleboro office generally attends a lot of these meetings, but I'm Nancy Dwyer. I am the regional manager for the Brattleboro and Springfield districts for hireability. And hireability underwent a name change several months ago, back like in March. So we were the Division of Vocational Rehabilitation. And we did a whole new kind of an upgrade in the name of our division. We're still officially Voc Rehab, but we are really known as Hireability Vermont now. So our focus is we serve Vermonters with disability-related barriers to employment, and we really interpret disability quite broadly. So very few people come through our doors that we can't find eligible for our services. We're a federally funded program. There is no financial means test to be eligible for us if you're eligible for our services because of a disability. So we are really focused on helping people get employment, preparing them for employment, helping them get training and education so that they can advance in their program, in their career. A few years ago, we really undertook a paradigm shift in helping people to really look at how to get higher wage jobs, the training needed, the education needed, so that really hopefully by the time they're done with our services, they're really in a much better position, that they're much more self-sufficient. And they're better off all around. So I don't think that we've had too many people, too many refugees. I think one or two have been connected with us. We're certainly happy to have questions from any of you around our services, people that you might be considering referring to us. Again, Leo Schiff is my counterpart in Brattleboro, who's the senior counselor, and he has been at some of these meetings. So we're happy to answer questions at any time. We really work with people at all. We do a lot of assessment. We do a lot of, helping people kind of prepare to get that first job, help people think about career goals. And I will say that I think that for our refugee population coming through the door, that we may not be as up to speed with our materials, that we are written materials, but I think that this is something that Hireability is going to be working on in the future, so that we're very accessible for everybody. We do have a website, hireabilityvt.org. You can just plug in Hireability, it will bring you right to that website. It's a new updated website, gives you a lot of information about all our different programs. So we serve youth in high schools, we serve people who are deaf or hard of hearing, we serve people who have been involved with corrections. So we run the whole gamut of age and disability. So I will put my phone number in or Sue, you were going to send that out anyway. And then Leo Schiff is also another person in the Brattleboro office. He's there 5 days a week, so he is our senior counselor. So has been somebody that's been at a lot of these meetings as well.
Thanks, Nancy. Any questions or clarification around Hireability or other Hireability staff that want to say anything about the work that you do? Obviously, employment is a huge area and a huge focus of the resettlement work. And so certainly consider Hireability as a partner in that. I know there's a lot of you working on employment services. So certainly if there are any barriers to employment, consider Hireability as a partner in overcoming those.
I will say we do also convene workforce and employment folks in a separate meeting. I'm sure everyone loves attending endless meetings, but yeah, so Leo and others on the call also attend those meetings. If you're interested in being a part of those employment or workforce specific meetings, you can let me know, and I'll add you to that list. We do try and separate things out a little bit by topic area, but Hireability is a great partner in all of this.
Thanks, Alex. So Department of Mental Health. So as I mentioned, designated agencies are how we do that work in partnership with HCRS on the Brattleboro side, Windham and Windsor County, and United Counseling Services or UCS on the Bennington side. And I know we've got folks from both of those organizations. And I think I understand that HCRS also has a refugee mental health grant that was awarded through the state refugee office. So maybe Steve, you can kick off with some information about that or an update, and then certainly want to hear from both the DAs around your work.
Absolutely. Thank you, Sue. I'm Steve Jurencup, the area manager for the Brattleboro office. We also have offices in Springfield and in Hartford, Vermont. We do have a collaborative grant with ECDC, so we're working collaboratively with Joe and Camilla. We have we'll be hiring a case manager, and until we get that person hired, we will be using one of our existing case managers to help fill that gap until we get that position hired. We've interviewed one person, looks like a very good candidate, and we have a couple more candidates to interview before making a decision about hiring the person. We hope to have that done by the first of the year at the latest. We provide mental health and substance use counseling services. We have it's kind of an 800 number. It's 855. I'll put it in the chat. Put that number in there. It's called Open Access. People can get an assessment within same day or next day access. trying to get services out there to folks as soon as possible. After the assessment, we do have a bit of a wait list at times to get them assigned to a therapist, but case management is generally pretty available. Any other questions? Oh, also we'll be working with UCS in the Bennington area with this grant. So that will be covering that area as well with UCS collaboration with them.
Thanks, Steve. And I know you mentioned hiring. Certainly, if it would be helpful to send that sort of posting out to this team, maybe folks know folks. This would be a great network to understand that. And if you have a timeline, I know hiring and workforce is kind of sort of the biggest challenge confronting us all. But if you have any sense of a timeline of when that work might start or when that person might be available, that would be helpful.
Thank you. Well, we're interviewing now, so we hopefully we'll have that position filled by the first of the year. That's our timeline.
Great. Okay, and Lori, I don't know if you want to talk about UCS or if there's anybody else that I've missed from either of the DAs that want to.
Sure, I can speak, but I'd like to also invite Grace. Really, truly, Grace is spearheading for UCS. So I guess what I want to start with is I am so grateful for this group. I have been brought to tears many times just listening to the services that you're providing the refugees. So thank you, thank you, thank you. I will say that United Counseling has a service called FAST, Finding Access to Service and Treatment and Services, and we are open 8 a.m. to 5 p.m. And so people walking through the door can get immediate access. I did send an email to our intake folks to find out how many people we've been using that we've also used translators for. I know I myself have covered some, so I certainly know that it's working and it's working well. This is a new program that we started in January, and the reason we started this is that we wanted people to get immediate care. We are using a modality called collaborative network approach. In the world, it's called open dialogue. In Vermont, we call it collaborative network. And the reason that we're using that is that we have found it to be incredibly respectful form of treatment. And because the way we designed it, people can come back as many times as they want to those first 30 days. So they could come back every day and get services and support before we have to open them and assign them, right? So we have certainly Department of Mental Health guidelines that we need to follow. But so it's been really useful. I am happy to hear about hireability. We have Betty Kenyon that works for us that does work for hireability. And so that is something that I'm excited to share with her, that this may be new referrals for her for Bennington. And I do know I've got someone reaching out to me now from the ECDC, and I will also look forward to hearing from Steve around joining forces. And Grace, what would you want to add?
Nothing for now. Thanks, Laura. I think we're enough time spent on this.
Thank you to our designated agency partners. It's tremendous work. And again, just want to make sure that folks know how to access mental health services and for your clients and families you're working with, how to access mental health services. Lori did mention there are some within our, and this is a little different depending on the district, which is challenging, but we do have some embedded partners. So there are some state staff from some of these departments and divisions that are embedded in other places. And so that's also a way that we can kind of integrate this work. And so Reach Up is one example and others. And I know USCRI, I think, has, a history of having some embedded providers from AHS right there, kind of in their offices. So again, they're a little more mature in their work in this area. And we certainly can think about what would make these transitions in these relationships and this service more integrated. And so we are also open to hearing from you, obviously, about what would support this work and how we can be more integrated together. So before we run out of time, I do want to provide, I know, I think Sarah Pugh is here from the Windham County Dental Center, I believe, and has some updates around refugee dental services. So I want to give her a chance to update you all as well.
Hi, everybody. I'm actually working with United Way of Windham County. So our fund will be working with the Windham County Dental Center, but it's not exclusively through the Windham County Dental Center. I'm working on the charitable dental care fund. We were granted some funds from the state to help expand dental care access for refugees and asylum seekers in our area. The fund will greatly expand the $1,000 Medicaid limit that currently exists on dental care. However, we're still sorting out what exactly this grant will be able to cover. It's possible, for example, that things like more complex procedures such as dentures won't be able to be covered by the fund. But we're working that out right now. I've created a dental care survey to help streamline the process of intaking clients and getting an idea about what their general state of dental health is right now, if their issues are urgent or causing pain, and as well as just, taking in some contact information. So we're currently just working really hard to create relationships with dentists and other oral surgeons, endodontists in our area to make sure that we have a system set up for these clients who might have some more advanced needs than other people, just to get into their systems. But the reality is that right now there are extremely few Medicaid dental appointments in our county, and there's an extremely high amount of dental need from this population and other populations. So there's just a major issue with dental care access, but we're working hard to think of creative solutions for it. And if you or others, are working with refugees or asylum seekers in our area who are in need of dental care, please get in contact with me and I will send over the survey to make sure we can get that filled out for them and try to get some dental appointments going.
Thanks, Sarah. And if you, I imagine there's some type of referral process or some way to sort of formally connect with that services. So if you can provide, more detail around that, that would be great. And it looks like Joe has a comment or a question. Go ahead, Joe.
Well, mine is not a question, Sue, but just a comment. I know we're coming to the end, but I just wanted to use this for also to thank everyone, all our partners. It's about we heading towards 1 year now since the first refugees arrived. It hasn't been an easy journey, but I can see how we are stepping up and then learn from our lessons, and things are much getting better now. And without you, ECDC wouldn't have made it. So I just want to use this on behalf of ECDC to thank all our community partners for all you have been doing for the past almost a year now. We also, I sent an email to Alice earlier on, but the point we will want to also be using this forum for our community consultation going forward. So we may have 2 community consultations here. Alice and I will work out the details, and we will love our partners that are here and all those that get invited to come to that consultation when the time comes. So in short, I just wanted to say thank you to all of you.
Thanks, Joe. It is the season of gratitude, but I think day in and day out, I hope that we're can express that. And I certainly feel a lot of gratitude toward you all. I know you're doing hard work, and I really appreciate all that you've done to support our new neighbors. And again, this meeting is really welcome. It is a monthly meeting. Alex convenes it through BDCC and the Working Communities Challenge Grant. And there is a statewide RISP-Net meeting as well that happens bi-monthly. And I know Tracy and Allie are on the line. I would say with health needs as well, I saw some questions about dental service. Dental access is a challenge for all Vermonters across the state, and Medicaid dentists and doctors for that matter, but dentists that accept Medicaid are few and far between. The health department does track those, and again, DVA would track any dentists that accept Medicaid. They do update that list, and unfortunately, often it's you reach out and they're not accepting new patients or what have you. So we know how entrenched this issue is, and so I hope that through Sarah's work and United Way on Windham County side, but also with our connections with DVA and the health department, we can continue to make the case that increased dental access, particularly for Medicaid providers or those that accept Medicaid, is really critical to people's health. And so this is, again, another place where we can highlight the specific needs of this population, but they are very much in concert with other Vermonters as well. And so hopefully that joint message can be heard loud and clear, and we can have some impact on that. So specific to the time frame of the grant, there is a specific question for Sarah about the $1,000 annual limit. I don't know if you can answer that question, Sarah, but essentially through Medicaid, there is a $1,000, I think it's a calendar year cap on Medicaid funded services. So I'm assuming this is to augment that and add to that, but why don't you say more about that?
Yeah, so you're exactly right. This is to add to that $1,000 limit. We have spoken with dentists about, early in the year, maybe they could bill the grant first, but we're not actually able to do that. That's not legal through the Medicaid contract. So, but the grant actually is going to be going until May of 2024. So there's plenty of time, which is great because it's very difficult to get an appointment, like I said. So yeah.
Great. Thank you, Sarah. Thanks for that clarity. We've shared a lot of information. I know we just have a couple more minutes, but if people have questions or comments, or again, a scenario that you want to run by us while we're all here, we're happy to listen and try to respond. I think I mentioned Children's Integrated Services as well, which is a piece of our the work. Ruben, go ahead, and then I want to give Allison a moment to talk about CIS. Ruben, go ahead.
Thank you, Sue. I figured that since we have the floor at United Way right now, I wanted to plug our VITA program. That's the Volunteer Income Tax Assistance Program. And this year we are, we had conversations with Casey Haynes at BDCC, and he wants to get the young professionals involved, specifically to get them certified to be volunteer income tax preparers, so that we can address the tax needs of the Afghan population who have now been here for at least a year and have been mostly working and will need to file taxes for the very first time in the US. And so we're looking for volunteers that will be willing to help out that effort and become volunteer tax preparers at the basic level. Basically, that means being able to fill out a W-2, being able to decipher a W-4 and putting it into W-2, 30 minutes later, taxes are done. So if you have any interest in volunteering for that program, you can reach me at my email address, ruben@unitedwaywyndham.org.
Thanks. Yeah, one of the joys of being a new American and working here is doing a tax return. So the joy just continues and the skill building continues. So yeah, a new reality for some of our new neighbors. And I know Allison put in a link to CIS. I just want to mention Children's Integrated Services. Those are specific services for families with children under 6, correct me if I'm wrong, Allison, who are having any kind of challenge. So there's nursing, there's developmental services, behavioral intervention, things like that. So family support. So really, it's a great tool. On the Brattleboro side, our Children's Integrated Services partner is the Winston Prouty Center for Child and Family Development. And so if you haven't been on that campus, that's a great place to get acquainted with. A lot is there, and Children's Integrated Services just want to make sure, again, as part of the system of care, knowing that there are pregnant and parenting families as part of our refugee population. And so thank you, Allison, for that. Sorry, we're kind of running short on time to dig into that a little bit.
So this is a great transition into the fact that our Children and Family Services folks presented at our last meeting, which is recorded. And so what I will email everyone shortly, maybe before the holiday, but maybe not, is all the resources and contacts that from Windham and Bennington County for the folks mentioned here. And what I hope will be ready is our Working Communities website, where you'll be able to find all of these meetings posted that have been recorded. So if you really want to hear this meeting again, a staff member missed it who you think would be valuable for, or you want to hear more about child and family services, you'll be able to find all of these recordings online, and I'll include that link in your minutes, in the minutes, and also.
Thanks, Alex. And I do want to offer on behalf, I appreciate the time today, and on behalf of all my colleagues, want to thank you all for your attention and time. Do reach out to us. We're here to help, and we're here to support this work. And we do want to be of support to you and want to get to know you and make this transition for our new neighbors as smooth as possible. And also, we can be available for some orientation and coming to you and to your staff and doing some of this work. I know we have co-sponsor teams and leads on this call as well. And so if there's an opportunity or a need to do some orientation in smaller groups, as you're adding and onboarding new folks, please don't hesitate to reach out. You can certainly reach out to me or the folks you've met today through the agency. So just open invitation to kind of connect with us and ask for what you need.
Great. Well, thanks again, everyone, for coming. And I'm just checking now, the third Monday, you can look for a meeting on the 19th, and we'll send more information about that in the coming weeks.
Thanks, everybody. Thanks, Alex.
Thanks, everyone.
Thanks, Alex.